One of the most common concerns of individuals and families on the path to early retirement is the future cost of health insurance coverage, specifically those years between when they leave their employer's group health plan and when they enroll in Medicare at age 65. I used to assume this topic of health coverage before Medicare only applied to people who plan to retire before age 65, but then I read a report from the Employee Benefit Research Institute claiming that 70% of Americans retire before they're eligible for Medicare coverage. To me, this data point indicates that early retirement isn't always voluntary and that we need more education and access to resources in this area. Before showing you how to review the public health insurance marketplace website to estimate plans and pricing, I'm going to briefly describe the 7 primary sources of health insurance available before Medicare. Starting off, continued health coverage may be available through COBRA if your private employer has more than 20 employees. In most cases, you'll be eligible for up to 18 months of continued coverage. Advantages of COBRA include keeping the same insurance provider and network and not having to reset the deductible and out-of-pocket maximum within the same calendar year. The main disadvantages are having to pay the higher premium cost, now combining the previous employee and employer premiums, and that limited coverage duration, usually only up to 1.5 years. If you'd like to estimate your potential COBRA cost, you can look at your previous year's Form W-2 in Box 12, Code DD, to review the combined cost of employer-sponsored health coverage. Since continued health coverage through COBRA involves an additional administrative cost, you can multiply your combined premium on Form W-2 by 102% to estimate the continued cost. Another option that may be available to you is retiree health coverage through your previous employer, usually requiring you to meet a certain age and years of service, and often tied to a pension plan with an immediate annuity requirement. TRICARE is a common example, specifically for retired military service members. The second option, if you're married and retire before your spouse, you may be able to join their workplace plan. Since this option requires one spouse to continue working, it isn't often a permanent solution as a family. Similarly, you may choose to retire from your full-time career to work for an employer who offers health coverage to part-time employees. University enrollment or group plans through professional associations may also be available, although these are typically not considered as permanent solutions. Option number 4 is coverage through healthcare sharing ministries. These are cooperatives to shoulder the cost of other members' medical expenses. This membership often requires the profession of religious beliefs, church attendance, and abstaining from recreational drug use. Pre-existing health conditions may apply, and treatment options may be limited. Although these ministries are not technically defined as insurance and cannot typically be combined with health savings accounts, HSAs, the coverage may be less expensive than other health insurance options. Next is private insurance coverage, available through a local health insurance broker, agent, or insurance company. Medical underwriting and pre-existing conditions apply, and the government-subsidized premium tax credit, which we'll look at in greater detail, cannot be applied outside of the health insurance marketplace. As we'll discover when shopping on the public health insurance marketplace website, households whose modified adjusted gross income falls below the federal poverty level for their given household size are not eligible for exchange subsidies, but they may be eligible for Medicaid, CHIP, and other state-specific programs. Lastly, and where we will spend most of our time during this lesson, is the public health insurance marketplace, commonly referred to as the exchange, the ACA, Affordable Care Act, or Obamacare, since it started back in 2010. The marketplace is not government insurance, but rather a helpful matchmaker between consumers and insurers. All marketplace plans have common features, including out-of-pocket maximums, no denial of pre-existing health conditions, and the availability of federal government subsidies in the form of a refundable premium tax credit, PTC, when household income falls between 100% and 400% of the federal poverty level. As an added note, the American Rescue Plan Act of 2021 temporarily expanded eligibility by removing the 400% subsidy cliff, and it could be extended through 2025. Tax and healthcare legislation is certainly up in the air. To review health coverage options through the public exchange anytime, you can start by going to healthcare.gov/C-plans. That's SEE-plans. There are 17 states plus Washington, D.C. that have their own marketplace website, but you can start here to be guided to the right place. To start your search for marketplace plans, you enter your zip code, and of course, you can also research plans and pricing in other zip codes if you consider moving at some point. As an example, let's pretend this family lives in Portland, Oregon, with zip code 97212. Before you can review and compare plan options, you need to enter data about your household, including your marital status, tax dependents, including covered children, and expected household income. Let's start there. If you know the plan ID for your previous or current coverage, you can enter that here or simply skip ahead. For this search, let's assume a family of four, a husband and a wife ages 45 and 44, with two young children, two daughters ages 11 and 6. We'll select you and other people for this household, even if they don't all need coverage. And they will claim both of their children as tax dependents, so yes. And 2. The wife's age is 44. She's female. She's no longer eligible for health coverage through a job or Medicare. She is the parent of children under 19 claimed as tax dependents, not pregnant, and not a tobacco user. And next, the husband is 45, male, also not eligible for health coverage through a job, and not yet eligible for Medicare. He is also the parent of children under 19, not pregnant, and not a tobacco user. And now we'll enter the tax dependents, both children. The first daughter is age 11, female, and none of these selections. And their second daughter is age 6, female, and also none of these. You will confirm the accuracy of your household members and move on to the expected income. Healthcare subsidies through the Refundable Premium Tax Credit, PTC, are available to households with income within a certain range, which is also based on the family size and where they live. To calculate your household income, start with your expected adjusted gross income, AGI, add tax-exempt interest, non-taxable Social Security benefits, and foreign income. You will learn how to calculate these in more detail during the tax return lesson. I always start my search by assuming no subsidies, so I enter a very large number here. Let's say 500,000. When we click Continue, we see that the household income is too high to be eligible for a premium tax credit, as expected. Now let's move on to view the health plans at their full prices, and then we'll come back to review the impact of income adjustments later on. 65 plan options show up in this example, but rather than scrolling through dozens of them aimlessly, you can click Add Filters to review plans across bronze, silver, gold, and platinum plans. You can filter plans by monthly premium ranges, yearly deductibles, whether the plans qualify as high deductible health plans, HDHP, with eligibility for making those health savings account HSA contributions. The bronze, silver, and gold plan categories indicate the percentage of health cost covered by the insurance company once the plan's deductible is met. Bronze is 60%, silver is 70%, gold is 80%, and platinum, although not seen on this search, is 90%. Bronze plans have the lowest premiums, but the highest cost when the care is needed, and vice versa. You can also filter by health plan types, EPO and PPO in this example. PPO offering two tiers, in-network and out-of-network coverage, while EPO is more restrictive to in-network providers only. If you or your family members have a pre-existing relationship with a medical provider, you can search for your preferred doctor's or healthcare facility's name to ensure they remain in-network. And similarly, you can filter prescription drugs to ensure they are covered by your marketplace plan. And lastly, you can filter plans by plan ID, insurance company, and medical management programs for specific needs such as weight management, pregnancy, asthma, etc. Let's start by searching for bronze plans that are HSA eligible. As mentioned during its own lesson, HSA contributions may still be available in retirement since they do not require earned income. You may be able to contribute to an HSA in early retirement, continuing to build those tax-free investments for qualified medical expenses. When we apply those filters, 7 plans are available to review. Each plan shows the monthly premium, in this case without any subsidies applied, the yearly deductible, and the out-of-pocket maximum. Since this plan's deductible and out-of-pocket maximum amounts are the same, that means this family must cover qualified health expenses of $15,000 first, but then the insurance company will cover 100% through the rest of the calendar year. It is very wise to have your out-of-pocket maximum amount saved as part of your emergency fund for those often unexpected costs. Navigating through the website while filling the spreadsheet template, I prefer to compare 3 provider plans per coverage category, including the plan type, whether it is HSA eligible as a high deductible health plan, the deductible and out of pocket maximum, and the estimated monthly and annual premiums. I find it helpful to view the plan's full prices and details before estimating the premium tax credit based on estimated income. That way, you can mentally account for non-discretionary cash flow needs and compare what you were paying as an employee with group coverage versus what to expect when covered through the public marketplace plan. Now that we understand the full plan prices, let's go back to the marketplace website to estimate the premium tax credit, PTC, based on household income. So when you click View Steps at the top of the page, then click Edit next to your household income, you can enter various income amounts to estimate tax credit eligibility. For example, starting at the higher end, a household income of $200,000 results in an estimated credit of $20 per month, which is $240 per year. But if they could control their household income and bring it down to $92,000, the estimated credit jumps to $964 per month, bringing their out-of-pocket premiums as a family of 4 down to as little as $1,500 for the whole year, versus over $13,000 without the credit. You will notice that if household income is too low, part or all of the family may qualify for Medicaid or CHIP coverage through their specific state agency. There are numerous quantitative variables and trade-offs to consider when reviewing health coverage through the marketplace, including whether you should prioritize maximizing that premium tax credit, reduce future tax liabilities with aggressive Roth conversion strategies, diversifying your taxable portfolio with rebalancing, other tax deductions and credits, or financial aid considerations. When you decide what to prioritize each year based on your own situation, you'll have greater confidence when it comes to implementing those decisions.